Welcome to Encouragement for Living Life with Lockwood and Lockwood. The guys are here to encourage you in your attempt to live more confidently and successfully in our world. They are highly trained and experienced mental health professionals, but they are not your mental health professional. They are sharing encouragement through information and discussion. People are complex. Just because an idea helps one person doesn't mean it will help someone else. You need to consult with your own professional who will hopefully know what is best for you and your situation. Now, it's time for Lockwood and Lockwood.
So we're going to do part 2
Mhm.
of types of treatment. And under the old heading, that we types of treatment and personal growth options for people.
Mm,
And the heading, the original part 1 of this was, don't bring a squirt gun to a house fire.
right,
Find the right kind of treatment.
right.
So today we want to cover inpatient residential, halfway and three-quarter way houses, sober living, and the topic of intervention.
Okay.
Okay, so let's start with inpatient residential. You want to describe those for people who might be
Sure.
looking to look for that?
Yeah, so inpatient and residential, sometimes these words are used interchangeably. And the
Right.
truth of the matter is, in a more technical sense, inpatient's separate because inpatient usually refers to like a psychiatric hospital where you're involuntarily, sometimes voluntarily, but involuntarily placed on a hold to protect you and protect the public. So you're very suicidal, you're very homicidal, or you're so intoxicated or so out of control with other mental health symptoms like bipolar or something of that nature that you're a danger to yourself or other people. And so that's why people are institutionalized in an inpatient program. And then we have residential programs. And so residential just means at a house, at a residence, where you're living there 24/7 and receiving services there 24/7. So some residential programs are in a super fancy mansion kind of place out here in Malibu. Some residential programs are more like deep in the city, and then you have opportunities to go out into the community and do things in the world. So there's different types of residential programs, but the essential feature of a residential program is, medically speaking, per what's called ASAM criteria, you need 24/7 supervision to either get better or not destabilize, one of the two things. So you could have a serious medical issue, like a liver issue. You could have a serious psychiatric issue, like florid psychosis or suicidal ideation. Or you could have just very serious cravings that can't be managed in an outpatient setting. And so the residential level of care, unfortunately, is one of the more common levels of care in terms of just like by volume, how many are out there. But most people don't actually need that, by the way. Most people with a mental health problem or a drug problem are just fine going to an outpatient clinic or an IOP or something. But residential is great for people who simply purely cannot stop using or who have such bad medical issues or psychiatric issues that they really do need 24/7 nursing, or they really do need 24/7 clinical supervision by, like, I used to be a clinical director at a res, and I wasn't technically on site 24/7, but I was basically on call 24/7. So if something happened at 2 in the
Right.
morning, Dr. Lockwood's getting a call. And so that's for people who are very psychiatrically or addiction or medically unstable, basically, such that they really need 24/7 care. So they eat there, they sleep there, they do therapy there, they get their meds there, they see the nurse there, they see the doctor there. They're very, very sick and they cannot function outside of that environment or something tragic would happen, basically.
A nice description. So it's really for acute issues, stabilization of people with acute issues.
Yeah.
And I always like to tell a little story here. I got a call from a doctor about
Mm-hmm.
his wife,
Mm-hmm.
and she was out of control with her drinking,
Sure.
and she needed an inpatient or residential treatment. And he kept complaining that the place she was looking at out in California
Mm.
had a chef and had yoga massage. And I talked to him for a few minutes and I said, really what I expect from that treatment, if she walks out of there believing that she is an alcoholic and that she needs help, kind of like accepting the first step of AA, that she has that knowledge, then they've done their job. I don't care about the yoga. I don't care about the massage. I don't care about the chef. If that makes it easier for her to go, let her go. And sure enough, she got a first step. She got knowledge and awareness that she has a problem and is willing to do something about it.
Great.
That got her through the acute phase of her recovery and returned here to return to treatment here in AA. So if in addiction treatment, that's really all we're looking for in an inpatient or residential. Can they get out of there knowing they got a problem? They need to do something about it. Committed to be willing to do something about it.
Yeah, in a more formal sense, the way ASAM would talk about it, which is the American Society for Addiction Medicine, is are you stable enough that you can move to a lower level of care? That's what they care about. That's what that means.
Yeah, I haven't
And
had to deal with DRGs for a long time, so.
yeah, I deal with it all the time. So, the other thing is, I just want to make a quick point about
Yeah.
goodness of fit, because you talked about
Yes.
the fact that she was referred to a fancy place with like a chef and yoga, which is becoming more and more standard nowadays than anything.
Right. Right.
Um, but, you know, I've had the experience being out here in LA of working with celebrities. And so the issue for people who have a different socioeconomic status, people that have a lot more means or a lot more notoriety, it is a very different life, to be honest, right? Like there's,
Mm-hmm. Right.
anyone can get stable medically anywhere, to be honest. However, what I would also say is if you're from that unique group of people where your life is radically different just because you're famous, it's really hard to go to a regular rehab, even a fancy Malibu place. That's still not quite necessarily fancy enough for some of them. And I know fancy is the word I'm emphasizing, but it's actually more complicated than that because if you're so used to being special in that way, number one, but number two, that people literally can't leave you alone. Right. Like that's a real thing that celebrities face
I
and
know.
rich
I
people
know.
face that other people, it's like, it's kind of the same thing as being a psychotic homeless person, where it's like people have this set of beliefs and stigma about you that they will not let you go of. You cannot be just a regular person, essentially. And so it's very hard for people on either end of the financial or notoriety spectrum to go to a regular program. So as much as people don't like rich people or don't like poor people, I promise
Right.
you it's a little bit easier for them if they go to a program that's more like culturally focused on, built for them, if that makes sense.
It
So,
does make sense. And also the question, and that may be helpful to some people listening, but also the question of how do you pick one?
yeah.
There's a ton of them.
Yep.
How do we recommend, what do we recommend to people? How do they pick one if they're listening to this? How do they do that?
Yeah, I think picking a rehab is super complicated because there's a lot people don't know, right? There's websites which say all sorts of things and promise things, like having a chef and yoga and whatever. But then there's the reality of how the program actually works, right? So obviously the first thing everyone has to think about, unfortunately, is cost, right? And so what can you afford? What will insurance cover if you're using insurance and all these things?
Right.
And you should be able to call the representative and get a very straightforward answer. You're in network, you're out of network, blah, blah, blah. You have a deductible and you have to pay this much on your deductible, which is a very unpleasant conversation. But if you can get through that, then the follow-up conversation, in my opinion, having run these places and consulting at them, is, what are your expectations for people while they're here? What do you expect people do while they're in your program? Do you expect that they just sit there and come off their drugs or get psychiatrically stable? Do you expect that they go to the gym? Do you expect that they go to meetings? Do you expect that they do individual therapy? Because a lot of these programs promise like super intensive work or whatever, but like we were saying earlier, the point of like the residential level of care is not to do super intensive work. The point of residential is to get stable, right? So for me, I'm very concerned when a residential program is promising like a bunch of EMDR or a bunch of this or a bunch of that. We're gonna cure, we're gonna help you see the source of your problem. Like, no, you're not. It's not possible. In 15 to 30 days, you can't see all of the causes of things and whatever.
No,
So
no.
when people promise you really big things like we're gonna help you get your life back on track, like probably not, you know?
Right. So, what are some factors to simplify this for people? Because you're right, but what are some factors? Because I think about how do you know who the staff is? Because the best programs have that staff that just is really cohesive and works really
Hmm.
well together, really loves people well, are knowledgeable. Um, and maybe it's typified by a really strong alumni that might be involved with the program because they
Yeah.
include people and bring them in and help them feel part of a lot of people who don't feel part of something. And do they get to go to outside AA meetings too, not just meetings in the facility? So they can get to know some people out there who are living out there and staying sober for various lengths of time. Because often alcoholics, addicts don't believe that someone's been sober 10 years, 5 years. No,
Yeah.
that's impossible. And they need to hear it
Yeah.
from people and see it with people that they can do it.
Yeah.
But to me, it's like, again, what you're mostly going to do is after your insurance and the financial part of it that has certain limitations, a lot of people,
Yeah.
find the treatment program with the best recommendations. And if you know someone who's gone through treatment and staying sober, that might be a good place to start. And the other thought
Yeah.
I have too is that sometimes, if you really are willing, if you're really ready, it doesn't matter where you go.
To some degree. Yeah.
You'll get enough of what you need to get you a foundation in sobriety or beginning to get your depression, your anxiety, the psychosis, whatever it might be, under control. Enough to some stabilization that you can continue on with treatment and know that you'll continue to grow.
Yeah. A thing that I always like to encourage people to ask when they're interviewing programs is, what are your thoughts about aftercare? Like, what are your thoughts about like continuing
Good
treatment?
point.
You
Good
know,
point. Yeah.
because depending upon what they say, they'll probably say something to the effect of, yeah, most people should probably go see a therapist and so on and so forth. Some people will give you an it depends answer, which I think is perfectly valid in many cases because
Hmm.
not everyone does need to go to
Right.
PHP or ILP or whatever. Some people just need to go back to work and go back to therapy or whatever. Um, so really, I want to know what their orientation is to patient care. I want to know how they think about people and if they think of people as complicated or simple. Because if you're telling me people are simple, I don't know that I believe you. If you have the perfect
You don't
answer,
believe them.
yeah, I don't.
Yeah,
You're right.
you don't.
Uh,
Neither do I.
so if an admissions person or a clinical director is like, it's simple, it's this, I don't believe you. I don't trust you because you have all of the answers about someone you possibly have no clue understanding. So, especially if it's like a first phone call. So, for me, I think I look for cheap car salesman tactics. I look for how easy the answers are because they are, it's a sales business. It's a business, you know. But if you're going to use cheap tactics on me, I'm going to be especially distrusting, you know.
And it really is hard to know what they really deliver because you haven't been there to experience that unless you've gone through treatment there. I got
Yeah,
a
or
call
you
from
know someone.
I got a call from a counselor in Atlanta, and he's saying, "I got this guy here, and I think he's got trauma." And I said, "All right, you guys don't deal with trauma?" He said, "Well, yeah, we say that we deal with trauma." But this guy was not going to get better without some real treatment for trauma. And this counselor was ready to send him to St. Louis to see me from Atlanta. And I said, time out. I know a guy that's trained me in Atlanta on trauma. I gave him the name and number of the guy and said, well, why don't you get him out to see this guy too, in addition to being in inpatient treatment,
Yeah,
and get him started on that and maybe work together with the treatment program and see how it goes. And if that doesn't work, then think about shipping him to St. Louis.
sure. Yeah,
You know what I'm
yeah,
saying? So, but it's really hard to know. But for family members, Don't fight the details. If your loved one likes some kind of treatment center, but you don't like it because of this, that, or the other, I don't care. If they're willing to go, get them there. It's a
Yeah.
place to start. It's like that
Yeah.
doctor. I don't care if they got massage or a chef or whatever the case may be. If she gets there and she gets the basics of what she needs, it's a successful treatment and it's worth the time and money to do
Yeah.
it.
Yeah, for sure. And
Get them stabilized.
it's stabilization. And sometimes people need multiple stabilizations. It's not
Oh yeah,
weird, you know. Now that doesn't mean they need 30 days or something every time. Sometimes you just need to detox real quick and get back to life. So it's a pretty variable enterprise as well. There's this um rigidity of expectations that some people have. And so we want to try to
I
not
know.
be rigid because there's a lot we don't know. There's also a lot the
Right.
treatment center can't tell you, right?
I know.
You
There's
know?
one thought about that too for a lot of people. It often disturbs me when people try a different treatment program. Unless the treatment program really is inadequate, which is hard to tell, I would go back to the same place if you need to go back again for stabilization because they have a history with you. They can sit down with you and look at what worked and what didn't work.
Yeah.
If you go someplace new, they're starting over
Yeah.
with you. So I highly recommend that unless you're sure the program or isn't sufficient or you know there's one that's really superior. Otherwise,
Yeah,
go back to the same place.
definitely. And on the operator side of things, having run these places, most of us have like a three strikes rule. We'll try a couple of times with you and see if we can do something different.
Yeah,
But
nice.
after two or three times, if nothing is really drastically going to be different, then we're really just enabling because you have a comfortable pattern with us that
Good point. Good
you
point.
know. So I
Yeah.
think you should probably not be going back to the same place 10 times, but maybe a couple of times for sure, you know.
If you're going back 10 times, come and see somebody like me
Yeah.
and figure out why it's not working. There's a saying that one of my mentors taught me that the least trained people are dealing with the sickest people in
Agreed.
hospital, inpatient, residential programs. Think
Yeah.
about that, the least trained people. And that doesn't mean that they can't be profoundly helpful. They can.
Yeah. Of course.
But no treatment center is going to pay somebody 300 grand like me to treat people in their treatment center. It just doesn't happen. Or it's very rare if it does happen at all.
Yeah, some of those places do.
So sometimes consulting with someone else kind of figure out what's really going on here that they keep relapsing or they keep not following through with their treatment for anxiety, depression, or why it's not working. Sometimes a consultation with someone that's really skilled in deep depth psychotherapy and has comprehensive understanding of a human being and what makes it difficult to recover would be worth checking in with. I've learned after my first 10 years in practice, rarely ever had to refer anybody to the hospital or inpatient
Hmm.
residential. Because if you know what you're doing, you can often keep people out of the hospital by intervening the correct way. And that's what I found in my experience. So even people that are highly dysfunctional and suffering acutely, I could take on a case like that and stabilize them in a couple sessions and get them on track to recovery, whatever the issue was. And not everybody can do that, but when you can do that, you save a lot of time and money, and you get people on track, and they're in less restrictive environment and things like that, which are all better things. And we'll talk later about the issue of going out of town, but we'll get to that one.
Okay.
All right. Let's see. Halfway house and three-quarters way houses. What are those?
Yeah, so sometimes those are referred to as halfway houses. Sometimes they're referred to as sober livings or sober living
Yeah,
homes.
right, right,
So, and that's more of like a regional thing. But
right,
basically, the purpose of these uh, non-professional programs, just so we're clear, is these are, again, just houses that are typically run or managed by someone who's sober themselves. And the
right,
spirit that I would say generally 9 times out of 10, the spirit of it is it's supposed to be a transitional place to live. So it's supposed to be a place to live as you transition from either like a residential that we just talked about or how would you call it?
Oh,
Or
inpatient.
or an inpatient psych hospital. It's meant to be a place
Right.
that you live temporarily, sometimes for a few months, sometimes for a year or two. Some of the sober livings I know out here in California, probably the maximum amount of time is like 2 years, but that's for people with very severe co-occurring mental illnesses.
Right.
Um, and so most of the time, these halfway houses or sober livings, they have varying degrees of structure and accountability. So some of them are on the very light end of the spectrum, where they have basically no oversight, no security cameras, no one's holding your meds, et cetera, et cetera, et cetera. And then on the very like extreme structured side of the spectrum, it kind of runs like a residential we were just talking about, where it's like there are staff
Right.
24/7 in the house, there's a live-in person, there's someone holding your medications if you have them, there's someone checking if you've gone to meetings, there's someone checking if you've gone to work, you're on a follow my phone app like Life 360. So there's and so it's like you're being
Right.
surveilled because you're
Right.
not very trustworthy in theory,
Right.
right? And so you've got everything in between those two extremes. And so my experience with them out here in SoCal for the last 15-ish years is there's not really a good model. It's really a question of like, what is this structure good for? Right. So for some people, like out here, um, I'm not going to say their name, but there's like a fancier sober living that's for people who are working professionals who kind of burn their life down but can get back on a good foot quicker. And it's
Sure.
for people who are like C-suite people, you know, who have been like they've run their own business or they've been executives or whatever. And they specifically cater to like people probably above the age of 40 who have had a life, who've had a career, who've had a family, and their job is to get these working professionals who are probably burnt out for whatever reasons into recovery in this area and back into like a working man's kind of culture, if that makes sense. So they're very niche specific. Whereas other sober livings are dime a dozen. Anyone can come, doesn't matter what age, doesn't matter what your life experience is, doesn't matter if you really need to be sober, if you have serious mental health problems, they'll just kind of take anybody. And then there's old school halfway houses, which are kind of like Oxford houses, which are basically focused
Right.
only on you doing recovery. And it's like, figure it out is the mentality, right?
Get a
So
job.
each of these programs or each of these sober living types serves a particular kind of client and they're all cash. So you're going to have to pay something. And in some cases, you'll pay nothing,
Right.
obviously. Like Oxford houses are usually free or state subsidized or something. But most sober livings that are privately owned, usually it's like $500 a month or whatever. And some are super fancy here in Malibu, which are like, a few $1,000s a month or 5,000 or one out here I know is like 10 grand a month. And I just can't imagine having like a Mercedes payment for a sober living, but let me know, you know. But it's like it's a super nice place, to be
Sure.
honest, you
Sure.
know. So that's kind of my understanding.
Well, I think that's a great description of the various degrees of supervision, treatment, accountability, things like that. So there's a wide variety. But I would mention just listening to you, and people are going to be wondering if they're listening to us, are going to go, well, what about other mental health stuff, not addiction?
Ah,
What kind of, see, because this whole field of halfway houses, three-quarters way sober living, all came up in the addiction field.
yeah.
They're the ones that built this kind of stuff out of the needs for the recovering alcoholic addict.
So I would say there's a lot of variability on the addiction, substance use disorder side of things. On the mental health side
Right.
of things, my experience is more limited, but I know a number of them out here. And usually, I would say most of the time, if not all the time, most psychiatric halfway houses that are purely for mental health related purposes, usually those are paired with actual psychiatric services like an IOP program or a psychiatrist. There's one out here called
Right.
PSL, I think, that does that. And They're specifically for people with serious mental health problems, serious depression, serious psychosis, serious bipolar. And you have to be on meds. We are going to make sure you take your meds, but it's a sober living, so you'll have some freedom and autonomy kind of thing. But there's less variability for those. Because
Yeah,
usually it's almost
right.
always like you have to be in a program, you have to be receiving care to be a resident here. Whereas in the addiction side of it, you could be doing whatever in some of these houses, you know?
Right. The only program I know here, again, I don't stay in touch with the various programs like I used to, but the only one that comes to mind are there some eating disorder programs that might have more long-term stays for people that need long-term stays. But they're just in the mental health field, there's just not the same resources there are as in the addiction field.
Yeah, agree. And,
You know,
most of these sober livings take mostly dual diagnosis, so addiction and something else.
right, right.
But, most of these sober livings nowadays, I would say at least half, excuse me, are paired with some outpatient program like an IOP or something. So it's like the person who owns the house either is best friends with the person who owns the IOP or is a co-owner of the IOP or owns both. That's the Florida model for people in the know. And that's become the norm, at least here on the coast. And I think that's true for the East Coast as well in the South.
Yeah, there are some clustering, by the way, for people, just if you're curious, of where addiction programs in this country are. California, Texas, Florida, I think maybe East Coast, some area there, although I'm not as familiar, where there's
Hmm.
many, many programs to choose from.
Tennessee.
Well, Tennessee's traditional, actually. That's right. Yeah,
Yeah.
yeah,
Yeah.
they have
Tennessee
a
has
good
lots
number
of
too.
problems. Yeah.
Right. And you're fortunate if you live in those areas that you have quite a choice range for, your loved one or yourself. But that goes to that issue we'll talk about later about traveling for treatment.
Sure. Yeah.
The last one I want to talk about in this podcast is intervention.
Okay.
Something that's been around a long time that I was trained in long before people even knew what intervention was. There was a guy in Minneapolis that developed the whole process of intervention. And that's the whole idea that someone can be motivated to seek treatment by an intervention of the people in his life that care about him or her. And to do it right, it's very important that it's done with love, without anger. And it's a whole really strict process that people go through. To do it right, it has to be people who love the person, are not going to disrupt the intervention, are going to be cohesive with the other people in the intervention, who then confront the person with a mental health or addiction and or problem in a loving way. And when done well, Vernon Johnson, the founder of interventions, he was an Episcopal priest, I think.
Hmm.
Um, he said he never had one that didn't work. And now this is the addiction field, mind you. That's where it started. But that's because he would spend hours and hours with family preparing them to talk to their alcoholic addict family member in a way that would be most likely to help them desire to seek treatment. And if you understand and you've done any, and I've done a few over the years, you really do. You even have to eliminate people from the intervention because of how angry they are and they can't control their anger. They can't be part of the intervention. If they can't follow through with writing out the incidents that they're aware of that the person caused or created by their use of mood altering drugs, alcohol, other drugs, they can't be in there either. They've got to be both useful and loving to be in one. And when it's done well, there's a lot of healing in the family that goes on in the preparation work for the intervention. They have to learn a lot about addiction. They got to usually go to Al Anon, become familiar with that, become familiar with the field and the resources. And then, most importantly, write out the material that's going to lead to the confrontation of the person that has the problem and what the family's position is going to end up being with them if they seek treatment or don't seek treatment. And like I said, when done well, it's a beautiful thing. And it creates a lot of healing and a chance for someone to start treatment with a really solid family behind them in the right way. Any other, did I miss anything there?
Yeah, I mean, there's just so much to
Yeah.
say
I
because,
know, I know.
Johnson's one of the oldest and first, but the field has evolved drastically
Oh yeah. Oh yeah.
since him. So like most people nowadays don't even do a Johnson style intervention. They do what's called an invitational intervention because
Okay.
whether or not it's true, I can't speak to how true it is, but I think the reputation that old school Johnson style interventionists got was they were too confrontational, right? Where they weren't inviting people and using skills and tactics like motivational interviewing that actually help. They were confronting in a way that, as you said, involved their anger, involved coercion, right?
Right.
It wasn't
Right.
loving, it was coercive. And
No.
so
Yeah.
again, that's a
Yeah.
reputation thing that may or may not be grounded in reality. Like you can
I
there's
don't
only
think so.
there's one
But
person.
I think it could be misused like
Yeah,
that
yeah.
with
Yeah.
certain counselors or yeah.
Yeah, and I'm sure
Yeah.
there's plenty of people who did misuse it. So I'm sure the reputation didn't happen for no reason.
Yeah. Not
However,
from Vernon Johnson for sure.
no.
Yeah.
And so, Dr. Judith Landau is one of the first who talked about the invitational intervention. I've hung out with her a few times. She's fascinating, South African lady.
Gotcha.
Um, and so she's one of the founders of this like reaction to the Johnson people. And her belief, which is not super unique, I think it's not even that drastically different than Johnson, is that when we're coercive, and the thing is, it's not always super clear, right? You and I have talked about this a little bit on this podcast, but there's so much more to say. People aren't always super clear about their motivations. And that's normal. That's not
Well, sure.
unusual,
Sure.
right? And so
Right.
you might be writing out like something that happens in a lot of interventions is interventionists will tell families to write out a script of what they're going to say. And sometimes the script
Right.
is very structured in a way that works for their whatever process.
Sure.
And so like sometimes you'll have information in your script that you're going to say to your loved one when you're doing the intervention. And you might write something down that makes perfect sense, but then when your emotions show up, you might have an entirely different set of motivations that show up because the calmer
Well,
version of you
right.
that was writing the script and talking about it with the interventionist or whatever is a different you to some degree than the like maybe terrified version of you or a helpless version of you or egotistical version of you or resentful version of you. And so
Right.
those forces are real and I'd
Oh
say
yeah.
pretty typical for someone who is in a relationship with a person with a severe mental illness or a drug problem. It's not
Right.
weird. It's not weird to be
No. No.
traumatized by your loved one who's ill.
Right.
People who are ill often traumatize the people around them. That's not weird.
Yeah. Amen.
So what people really need to understand is whatever the model, your interventionist really has to help you understand your side of the street as the family member who's concerned about their ill loved one, because you have all probably the best intentions in the world. You're probably exhausted or tired or concerned or lost or whatever it is, and that's all normal. And that's why you would seek out a professional. The problem we face, though, is that many of these interventionists are not fully acknowledging all of what might be going on with the family members. So you said earlier, like you want to make sure you eliminate the people who are especially angry and can't get it under control. That's a
Or
great
egotistic or
or
egotistical.
or egotistical.
Yeah.
In my experience working out here in SoCal with upper middle class people and upper class people, you'll have one or sometimes two family members, but maybe both parents who are very egotistical and they know better and that's it. And the end of the story is because I'm a successful CEO or I'm a successful doctor or whatever it is, I know better, and you should just do what I say, son. You should do what I say, wife, husband. And it's like, that's not loving, and it will never work. It's
Well,
coercive.
it doesn't work.
Yeah,
Or it rarely works. Some people may comply with that, but it takes them into treatment with a bad attitude, a lot of resentment that can get in the way of the treatment.
right.
The
And
whole
that's what
idea of
we're
the
talking about.
intervention is for people to go into treatment with a sense that people really care about me. And yeah, you got to deal with that ego of people and their resentment and sometimes rage at people. You
Hmm.
know, that's why Vernon Johnson spent so much. That's why he could say, I never did one that was unsuccessful, because he would not do it unless the family was really ready to do it in a loving way.
And I think that what you just said is kind of important for people to know because when you're in a desperate state of mind, like, oh my gosh, my kid is in a car somewhere in South LA, what's happening? Because this has been the experience,
Yeah.
my
Yeah.
experience being out here is like, I deal with upper middle class or whatever parents who have this like 18-year-old or back in the day, adolescents. And it's like, what do I do with my kid? I'm in a crisis state. And so it's like, let's go talk to the kid right now and solve the problem right now. Like that's not really an intervention, right? That's
No,
like
but
crisis,
when
that's crisis case management.
that's right, when a kid's using fentanyl, parents can just be freaking out and want to do something right now.
Yes.
Yet they can't control it, and you have to really help them to prep it the right way so when they do it, they have a better chance of getting that kid into treatment.
Yeah. And so good interventionists will always try to slow things down. They'll try to slow you down, in my
Right,
experience.
right.
I have a couple of dear friends who are interventionists and they do excellent work. And the reason I think they
Nice,
do excellent
nice.
work is because they're willing to take a look at a crisis and assess it and go, how much do we need to act right now versus how much do we need to prepare right now? Right. And it's not weird that sometimes you do need to act right now, right? Because maybe like calling the police for
Whoa.
a wellness check or something.
Oh yeah, sure. Someone's
That's
suicidal, or yeah,
or like
absolutely, or
overdosing
homicidal, or
or overdosing.
overdosing.
Yeah, yeah.
Absolutely. Yeah.
Yeah. And so, like, if you have reasonable suspicion that your loved one might be like overdosing or something, of course, call 911 and try to whatever.
Absolutely.
But,
Right.
like, that's not always super clear, right? Because a lot of family members
Yeah.
of addicts are ignorant. They don't use drugs in the same way or at all, you know? And so they don't
Right.
understand the difference between nodding out because you're just kind of intoxicated versus like nodding out and not breathing, you know? And there's no
That's
also
true.
there's also no expectation that family members would actually understand the difference, you know? So,
Well, they're not trained or experiential, they can't understand the difference, but so the interventionist needs to teach them, or the case manager needs to teach them, so
right.
they can, if it's just using, normal using and not putting them at risk, they can relax some,
Yeah.
right? And if it is really putting themselves at risk, then there are options, and what do you do about that?
Right.
Right.
And that's why you want to find an interventionist who will help you slow down, right?
You
Because
betcha.
it is perfectly natural to be in some level of a crisis kind of mind state. And you don't even need to get rid of that. That might actually still be useful to some degree. The question just becomes,
Sometimes.
yeah,
Yeah.
yeah, sometimes.
Yeah.
And so the question becomes like, is this person going to help you slow down? Is this person going to help you see the whole story or just the immediate situation? Because if they're going to help you see the whole story, then they're probably going to help you find the right treatment for your loved one, is my guess.
More
Yeah.
likely at least, right? For
Yeah, yeah.
sure.
Because most
Yeah.
of the time it's more complicated than they're just using drugs, you know? So,
Absolutely.
a lot of kids, for instance, if they're under the age of like 20, are often in these really weird drug using relationships with romantic partners, boyfriends and girlfriends,
Oh
sugar
yeah.
daddies, unfortunately. A lot of these young people will go live at like a trap house. Even like very wealthy
Oh
kids will
yeah.
go live at a
Oh
trap
yeah.
house.
Oh,
One of my
absolutely.
one of my favorite stories, if I can tell this super quick.
Yeah, yeah.
One of my very first patients out here in my postdoc was this lovely young man who I hope is still with us, but I have no clue, honestly. But he was just perfect at telling you the right story and then secretly going out and doing the exact opposite of whatever the story is. And one night he was living at a sober living and he was seemingly doing well, doing the steps and all these things. And family therapy was like sort of going well, but he made up the perfect excuse. And this is like an upper middle class family kid, you know. And so his parents would never have believed this. His friends in the sober living would sort of believe it, but not sort of believe it because of the type of kid that he is. And he got arrested that night. Back when heroin was the thing, now it's all fentanyl, but back in the day, he was
Right.
like in a trap house in like this crappy rundown place with like 5 or 6 people getting high, shooting up heroin. And his parents didn't even know how to make sense of it because he had this persona, he had this mystique as like this middle class kid
Oh
who's
yeah.
just kind of anxious and just kind of struggling with heroin. But they couldn't conceive of him as being like the stereotype of a junkie who goes to a flop house where a bunch of people are getting high together. They couldn't process it. And even his sober living manager, who's one of my dear friends, was like, I knew he was kind of a scoundrel and he lied a lot, but I wasn't sure he was that kind of scoundrel. And like, and everyone's belief about how sick he was drastically changed. And so we had a family session
Absolutely.
the next week that was more like an intervention than a family session
Right.
because it was like there's an entire level of your secretiveness and your disease, etc., that you're not really even talking about, right? And sometimes families
Right.
are really caught off guard because there's levels to their loved one that they couldn't have predicted, you know? So
Oh
it's
yeah,
okay to be
for
shocked.
sure.
Families are
For
often
sure.
shocked, and that's part of the
Well,
reason they are in crisis mentality.
well, I tell parents, or I used to do a lot more because I've done over 100 evaluations. I mean, comprehensive, time-consuming evaluations of adolescents, young adults over my career. And I tell parents, the parents are typically the last to know either that a problem exists or the extent of it.
Absolutely.
And that's the truth. And they're not necessarily supposed to know.
Yeah.
They're parents and they're not trained in this stuff. So it's really important they understand that these things go on all over the place and parents don't know, excuse me, until it reaches a crisis
Yep.
that all of a sudden it's in their face and they have no context to understand how bad it is. They're shocked. They want to do something, but they have no idea how bad it is. And if they have a good interventionist or case manager, someone to evaluate it, then they can get a fuller understanding and be given an idea then of what kind of treatment's going to match this. Again, don't deal with a house fire with a squirt gun
All
unless it
right.
just started in front of you a second ago and you can put it out with a squirt gun. Find the
It-
right level of treatment for the
yeah.
problem.
It's also very important to not overreact in the sense of like, you
Hmm.
might be a very naive person. You might have had no relationship with alcohol
Right.
in your entire life or other
Right.
drugs. And you might be shocked that your teenager's smoking some weed or drinking a little bit. And that shock is about you, not about them necessarily. Because although
Right.
I clinically and personally don't think adolescents should be using drugs, if at all, but I understand that kids will more often than not. We have all this
Oh yeah.
data from SAMHSA that
Oh yeah.
shows that most kids have consumed some drugs before the age of 18. So it's not weird statistically. But the difference is if your young one is occasionally consuming substances, that's probably a very different type, especially if it's a kid. If you have a kid and you're concerned about them, it's different if they're
Mhm.
occasionally using substances than if they're using substances on a regular basis, like weekly or more frequently, right? Just like if you wanted to draw a
Right.
line in the sand super quick for adolescents in particular, occasionally is very different than regularly. If there's a pattern and it's like more frequently than once a month or even once every other week, something's probably
Right.
up. And if
Oh,
it's like,
for sure. And you're
but if,
getting in another area that we can certainly at some point we'll go into more, what is addiction? And
yeah,
how does
yeah,
how how does addiction really look like in people's lives? And
yeah.
I can share a little bit about that.
Yeah, we both can. I think, but I'm just saying, like, for the sake of like, you probably don't have to hire an interventionist if your kid's smoking pot once a month or
No,
something.
no, no. That's
You
important to
know,
people know that parents get
yeah,
scared, but they
yeah,
really need to have a sense of what's going on. And sometimes again, a good evaluator can give you reassure parents.
yeah.
Maybe it's rebellion, maybe it's, curiosity, maybe it's a lot of things and not. I had a adult come in a couple of weeks ago and he said, I don't even know if I should drive. I'm so hungover.
Mm,
Well, he's a president of a company.
Yeah.
And
Yeah.
so I tracked that. I didn't say anything. I
Yeah.
tracked that, and then he didn't show up to the 2 appointments later, so I brought it back up. I said, "Does that have anything to do with not making it last week?" And we
Mm,
went in and talked about his drinking.
mm,
Is it a problem? And began to just hold a conversation about it. And his father's an alcoholic, et cetera. Anyway, but so I gave him a little education, so he could begin to think about more about what he's doing with alcohol. And I don't,
mm.
at this point, I can't say he needs an evaluation for alcoholism, but he brought up the concern. And then when you don't show up the next time, you wonder if it's because of drinking like the last time.
Yeah.
So anyway, you address it so you can kind of begin to explore it and develop a relationship with it. A lot of times people are not going to tell you the truth until you build enough trust in the relationship to
Yeah.
really let you know what's going on. But
Yeah.
again, I don't want to go too far with that. And we want to just give you some sense of a couple more treatment areas. We covered inpatient residential,
Mm-hmm.
um, halfway houses, three-quarters way houses, sober living, and hopefully some help for you guys on what intervention is, what a good interventionist will do with you, which can be highly helpful in motivating a person in your family that has been resistant to treatment to seek treatment.
Thanks for listening to Encouragement for Living Life. We hope you were encouraged by today's discussion. If you have a question, you can email us at lockwoodwithlockwood@gmail.com. We'll do our best to answer it on one of our shows. Hope to see you next time.